name of Deputy Mattie McGrath, the Minister for Health, to discuss the appointment of a GP at Ballymacarbry Health Centre, 4 Mile Water, Clonmel. I understand the Deputy is sharing his time.
With Deputy Butler, indeed, I am. Happy to.
That agreed?
Agreed? Hope so. Thank you very much. Thank the Councillor Kate Dulce for allowing me this topic this evening. Former Water Health Centre, which is located just across the border from me in County Waterford, serves the parish of Ballymacarbry and my own parish of Newcastle in County Tipperary. Denier and Ballymount, Turnina and even further afield is a wonderful rural GP service with over 1,700 patients, 1,050 of which are private patients, so the service is very viable service. Since the origination of former GP linked to the service, Dr. Janes, who resigned in April of this year, the service has been operating with locum GPs service and has been a significant concern about the future of the health centre. And I want to thank Dr. Janes and indeed his staff, and also previous doctor Bill Dunham and his good wife, and indeed Mrs. Hallahan, who worked there for years and decades of service. In June of this year, the post of full-time GP for former Water Healthcare Centre was advertised, and a successful applicant has been offered the position in July. It is my understanding that the unsuccessful applicant accepted the position in August. However, to date, contracts have not yet been signed. There is real concern that the successful applicant wants to reduce this service to a part-time service, operating a morning-only service, thereby bringing his patients to his current practice in Clonmel, which is a real concern to the many patients who would have to travel significant distances. Some wouldn't have cars and couldn't get taxis. It's my understanding that there was a number of interested applicants for the position, 4 in all I'm told, and I want to know what is the delay in having the contract signed and getting the new GP in place. If the successful applicant is no longer interested in providing a full-time service at former Water Health Centre, why has the HSE not moved on to offer the position to one of the other 3 who look for that panel? Former Water Health Centre are in a very fortunate position whereby it is deemed to be viable and received significant interest from GPs, 4 in all, something which is rare in the current circumstances throughout the country. If the doctor is no longer interested in providing a full-time service, which the HSE informs me that they are committed to providing, what then is the delay, or why then is the delay in moving forward to selecting a new candidate? There is no GP service in Clonmel or Dungarvan, for that matter, that will have the capacity to take 1,700 patients to a full-time service from a full-time service in former Water. Very good.
Minister, I would like to thank Deputy McGrath for the time on this particular issue. The 4 Mile Water Health Centre is located near Ballymacarbry in County Waterford, close enough to Clonmel. It's a rural practice which provides essential medical care to the local community in Waterford and indeed South Tipperary that has over 1,700 patients. The previous GP at Ballymacarbry 4 Mile Water Health Centre was on sick leave in October 2017, and he subsequently resigned his list, and the vacancy for the GP position was advertised in June of this year. The staff at the practice have consistently worked with HSE officials to source a locum until a permanent replacement was identified. And this has been done on a piecemeal basis for the last 12 months in order to give the patients continuity for this vital service. And I must stress it is in an extremely rural area. This was and continues to be an additional workload for all the staff located at the centre. Bearing in mind that the practice has been without the appointment of a full-time GP since October 2017, and even though the position of a full-time GP was advertised in June, the practice is still waiting for that appointment to be made. As far as I understand, there was a number of applicants to the position and a panel has been created. Interviews were held in July and we are still waiting for confirmation of the appointment today. It's causing huge uncertainty and distress to many patients and indeed to staff who have worked tirelessly to keep the health centre open, operating until a replacement can be identified.
Thanks, Controller, and to thank both deputies. I'm taking this on behalf of Minister Harris, who unfortunately can't be here. The Government is committed to enhancing primary care services in Ireland and to engage with GPs representatives on all necessary improvements and contractual reforms that will enable GPs to better meet the needs of their patients while promoting general practice as a visible and rewarding career at both existing doctors and future medical graduates. Agreement on the delivery of these services must need measures and reform as potential to facilitate substantial increase in the resourcing of a general practice on a multi-annual basis. The goal is to develop a contractual framework that has a population health focus, providing in particular for health promotion, disease prevention and for all the structural care of chronic conditions, while ensuring that patients throughout the country continue to have access to a GP service. The Government is aware of the workforce issue facing general practices, including the influence of demographics factors, and in recent years has implemented a number of measures to improve recruitment and retention in general practice. The GP's training place has been increased from 120 in 2009 to 193 places and in 2018, and an increase of around 60% over the 9 years period. As stated in the programme for Government, the intention is to continue to achieve annual increases in the number of training places available. The number of GPs on the specialised register continues to increase from 2,270 in 2010 to 3,700 in September 2018. The number of GPs holding GMS contracts have also risen from 2,098 in 2008 to 2,508 of October 18. Enter provisions for the GMS schemes have been charged to accommodate more flexible GMS contracts, and the retirement age of GPs has been extended to 72. An enhanced support package for rural practice has been introduced, which improves qualification criteria and increased financial allowance of up to £20,000 per annum. The HSE is fully committed to continue to provide full GP services for the Ballymacarbry Health Centre. Following the retirement of the previous GP in 4 Mile Waters in July, the HSE has arrangements for a locum full-time GP to be put in place. GP services in the practice continue to be maintained, and existing practice staff members have remained in their present role. The HSE is advised that a recruitment campaign has been run to fill the current GP vacancies. The process is now in the final stages, and the HSE is seeking to agree a start date for the replacement of the GP. In conclusion, I would like to reiterate that the Government's commitment to ensuring that patients throughout the country continue to have access to GP services, and in reaching an agreement with GP representatives on necessary services improvement and contractual reforms. And I'll come back on some of the questions that were raised by both the deputies.
Thank you, Minister. Deputies have 1 minute each.
Minister, this is typical, just you coming in here this evening, no respect to you, and not really have a reply that's on behalf of the Minister, which is useless, toothless and fruitless. Minister, we are worried. People are worried. 1,700 patients and their families are very worried. I want to pay tribute to the staff there and the nurses as well, who have kept the thing going, and indeed the locum that comes in and out from my own parish and Maria Byrne and Doctor. And look, the people are concerned. They don't want this kind of a report about statistics about GPs and everything else. They want the service. We have 4 GPs applied for it. If this doctor wants to subsume the practice into Clonmel, he shouldn't be allowed to do it. It's 12 miles away. As they don't have taxis, and many people don't have cars. He must move on. The HSE must move on. He's having meetings and negotiations with the HSE. The contract date for signing has been bypassed a number of times, or went off a few times, and they missed it. We want clarity, we want surety, certainty, and we want the patients of Ballymacarbry, Newcastle, Junina, Ballymount, and those areas and beyond to have the service that they are entitled to. We want the staff to have some future. It's an excellent facility, it's a top-class service there. All we want is a GP appointed that's not going to diminish the service and subsume it into a bigger practice than Clonmel. They can't take one patient to Dr. most GPs in Clonmel, and they might say 1,700, so we need clarity here, and we need honesty, and we need the people to be reassured that they will have a GP service.
Minister, it was evident months ago that the practice was losing its full-time GP, and I suppose the question I'm asking, and what the patients are asking, is why is the recruitment process taking so long? Full-time services were always provided in the 4 Mile Water Health Centre, and they must continue to be provided for in this rural area. I cannot stress how rural the area is, and you can understand with 1,700 patients coming here every day of the week, you know, they're very, very concerned, and they are genuine concerns. There's a genuine fear that this service will be downgraded to a 2 or 3 day service. And you know, you mentioned there about general practice. We all know that rural general practice is in decline, and it is in crisis. And we simply cannot allow this practice to be lost, and we will have to fight tooth and nail for it. Gorv Mahagut.
Thank you very much. Number 3.
Sorry.
No, we'll get the answer. Sorry.
We have an answer as well.
Well, I just have a short answer, if that's okay.
Sorry about that.
Well, to both the deputies, I can only reply on what the answer I gave you. I've taken notes. I don't know whether I made a mistake or not when you said it was only, according to this, there's a full-time practice, but I think I might have heard that it's reduced to a half-time practice. So I'm not sure. Did I hear that right?
Sorry, Minister, it's a full-time practice, but it's concerns that it might be reduced.
Okay. Okay, that's grand.
Yeah, 1,700 pages.
Yeah, look, Ken Corla, I've taken down the note and I've listened to the concerns of both both of the TDs here, and I will go back to Minister Harris. Unfortunately, he's had to run off to something else, and I will raise the serious issues, that the concerns that both of you have if this service is moved out and it goes to another area, that will have to be a lot of people who have to be facilitated, even just trying to get to a place from where they are. I'm not familiar with the site in questions, but I am familiar with Clonmel. But I will ask them to reply back to both of you, if that's okay. Is that all right? Okay.